Hi, I'm Dr. Dani Rabwin with Ready Vet Go, the podcast. I am so excited for our guest, Dr. G, today. So let's dive in. All right, welcome to Ready Vet Go, the podcast, where we are elevating veterinary mentorship. I am so excited to welcome our guest, Dr. G. Welcome. Should I call you Dr. G? What should I call you?
Dr. G works because the name Gersh Alaluf is a little difficult for a lot of people. I've been called many things. My favorite one was when I worked at the Animal Poison Control Center, and they used to call me Gaston.
Oh my gosh.
Like I was a Disney character.
Okay, that is one bit of your background that I did not know. I feel like there are so many little gems like that about working at the Animal Poison Control Center that I'm so excited to learn about. Can you just tell me a little bit about your veterinary journey and how you came into vet med to begin with?
Well, my veterinary journey started back in 1990. I had, as everyone does when they go to undergrad, I got to get my own dog. Mm-hmm. I got a liver Dalmatian. Her name was Amanda, and that dog seemed to get into all her trouble on Memorial Day, 4th of July, Christmas. I was always in the emergency clinics, and then I would have to do follow-ups at my regular vet. And I finally decided, I'm here all the time. I might as well get a job here. And I really didn't know what I wanted to do. I was getting my BS in chemistry. Was I going to go into pharmaceutical? Was I going to go into chemical engineering? Was I going to do something more fun? Because I really, once I got to college, I really understood the purpose of education. I didn't understand in high school. Mm-hmm. So I applied, and I was the geek that actually pulled out a typewriter and typed up my application just to put me over the edge, and I got hired.
So this is you applying to the vet clinic?
Yeah, the vet clinic.
As an undergrad.
I applied me to the vet clinic, and then all of a sudden, they brought me in and they started me in kennel. And there was two owners there, two male owners, Dr. Bob Whedon, Dr. Philip Lanzi, to this day, who I still talk to. Mm-hmm. And immediately they realized, hey, this guy's a full scholarship swimmer, and he's getting a BS in chemistry. We're wasting his talent back in kennel. So they put me as an assistant, and then from assistant, I went to head assistant, then I went to head technician, then I went to office manager. And that was all within a 5-year span. Yes, I took 5 years for undergrad. And I learned so much from them. I learned, most importantly, how to talk to clients. I learned the importance of treating your staff well. I learned the importance of being a team player. I learned the importance of communication to this team. I learned the importance of, if you have a partner, how partnerships should work correctly. And they were the two dads that I didn't have in North Carolina, right? And it was actually at a point where Dr. Bob Whedon, the day I got into Illinois vet school, he immediately rented a U-Haul for me, and he loaded the U-Haul, and he drove me to Illinois.
I love him.
Yes, it was amazing. And he always gave me shit because, if you look at the Whedon Library at Purdue, he told me, oh, no problem. He used to call me douche because he thought douche rhymed with Gersh. He's like, don't worry, douche. You're getting into Purdue. The first rejection letter I got, Purdue, right?
So
and,
good.
And he called the dean and shoot him a new one. Wow. And he's like, don't worry, he's going to get in somewhere. Yeah. But that was also the first year that they had the general application. That was so, Wisconsin was nice enough to say, hey, you're 1,147 on the wait list.
That's true? Is that what they said?
True story.
Whoa.
I was like, awesome. I got a chance. But, so getting back to that, that was the type of mentor I had. He was my coach. He was my sponsor. He was my networker. He was my friend. He was my confidant. And I was very successful in my veterinary career because of everything they had taught me.
Yeah.
Long story short, I graduated 2000, immediately started working. I was already ahead of maybe 90% of my class, not in grades, but in confidence level, right? So I knew I'm going to go right into general practice. I didn't believe I needed an internship. And I landed into a hospital in Laguna Beach with the same type of mentorship that was available that I had back in North Carolina, Dr. John Hamill. And if everyone in California knows who he is. Oh, he's the bloodhound doctor. But I mean, he was the president of the SCVMA, president of the CVMA. His wife was a RVT with a master's, and she still was an RVT. And she's on the board at AKC and OFA and Canine Health Foundation. So I was learning about his belief was like, as a veterinarian, you really need to get involved in the community of veterinarians. And talking about the importance of being a young veterinarian in Southern California with someone who had so much network that I met everybody.
Yeah.
It really put my the foot in the right direction when it came to being a solid veterinarian. And then I bought it in 2004. By 2011, I owned 2 veterinary clinics alone. And then I, of course, did sell to corporate during, everything has a price, basically, is what I tell people, because everyone's like, why'd you sell? And I'm like, when someone gives you 23 times EBITDA, oof, that's generational changing money.
Yeah.
And my wife, who's also a veterinarian, was like, we need to do this.
Yeah.
And I didn't want to. And and then obviously that's when you and I got to meet each other. You met me in my rage stage.
You were raging.
Right.
Yeah, you were a little bit raging.
Right. And, because they, when I sold, the corporate group I sold to gave me imposter syndrome, right? They made me feel as if I had done everything wrong. I was thinking, wow, could I really have done this much better? And so they forced me to, because I believe in education so much, I went to Pepperdine to get my MBA.
Yeah.
And then what my MBA taught me was I was doing everything right.
Yeah.
They were messing up.
Yeah.
And, the CEO of the corporation, the regional managers, the COO, the CFO, everybody didn't want to hear my voice because I was sending them empirical articles showing them what they weren't doing right.
Yeah.
And eventually they asked me to leave, which was fine because at the same time, the dean at Pepperdine asked me to stay on for my doctorate in business administration. So I'm doing my research, obviously, as we've talked about in early career veterinarians and the horrible attrition rate. And one of the biggest things that, we're finding is the importance of mentorship.
Yep. And mentorship is so key. And this journey, there's so many little things in there that I want to dive deeply into. I just want to kind of circle back to your first 2 experiences when you were talking about the vet clinic where you worked at before veterinary school and then your first job after vet school. You said you had similar types of mentorship, both in these veterinarians who really were pivotal in shaping your career. And from where I sit, it doesn't seem to me like it was just luck or coincidence that you happened to have these 2 really amazing mentors at 2 different places. I suspect there's something about you that helped with that relationship, or there was something about those people that you wanted to go work for them. Do you feel like there was a little bit of a secret sauce in there, something that was about you personally as a mentee, or things about them that drew you to them as mentors? Because there's often a mentor-mentee disconnect. People don't have this organic type of connection that we so crave and deserve, and you had it. So what was it about it? I don't think it was just luck.
Well, in your words, it wasn't an informal mentorship, that was more like a formal mentorship on both sides. I think it was my love to learn, right? And I always tell my children now as well, and my wife, she's like, why are you going back to school? I'm like, I think that when I stop learning is when I'm going to be on my deathbed, right? Because my biggest pet peeve is ignorance. And I think if you sit there and you don't question, and I mean, you don't have to question argumentatively, but question because you want to know. It really, really, really improves that relationship of the mentor-mentee.
Yeah.
Like, since day one, I how many questions? I mean, I had probably 10,000 questions, right? From like, what does this instrument do?
Yeah.
To, why did you choose that medication, for that animal? why didn't you offer this to this client? You know, like there are so many things that you've learned, and you know, because the problem is, and they give you. I'm not going to bag the technical education you get in vet school because I mean, the amount of knowledge you gain in 4 years is insane.
It's wild,
right?
Yeah, and it's way more than what you and I had.
Right.
I mean, the amount of knowledge that people are coming out with now,
with technology and stuff. Yeah, but the thing is, like, just because you graduated vet school, you can't stop learning.
Yeah.
Just because I was an undergrad, I was just learning. Your brain is a sponge. You're always going to be learning. And, you know, when I became that informal mentor, my answer to them always, and I know my assistant that's here in the room, Mallory, will agree, is like if they would ask me a question, I did what they did to me, which was, here's the book, look it up. Yeah. Nowadays it's like, here's ChatGPT,
right.
Look it up. Because I figured if you go look it up and you read about it, you'll get it better, right? And that's what they did to me. If you go and just ask a question and expect an answer, you're not going to learn.
Right.
You're not going to learn.
Right. So you need to have done that background or research first, and then go in with your very specific or crafted question to help guide you.
Correct.
Because you can't learn it all on your own.
Right.
You can't just go look it up. I mean, you still needed those people to guide you.
Right. I mean, you and I, we had a discussion yesterday about ear mites.
Yeah.
Right. And how everyone thinks ear mites and dog ear infections are so common. But I was like, well, let's see, 33 years, I saw one.
Right.
You know, you said you saw one or
what? I just love this. Like, this is what nerdy veterinarians sit around and talk about. Like, literally, we were talking about ear mites.
Ear mites. And it's like, you know, the thing is like, but if you didn't experience that, you didn't ask other veterinarians about that, you would be looking for ear mites in every single dog. Right. And I'm not saying you're not going to, but that's not high on your differential list.
Right. Yeah.
Right. But I mean, those it's just like those are the learning moments. And the other thing I would always do too is sometimes you just gotta be quiet and watch. Yeah. Just watch. Just learn. Like, think of where you're working in your mentorship relationship kind of like a reality TV show. Like,
what do you mean by that?
Well, just like sit back and learn. Like just be a fly on the wall. Yeah. See how your staff is interacting with clients. See how your doctor's interacting with the staff. See how your doctor's interacting with an upset client, a sad client, a mad client, a happy client. Learn the art of, and I call it an art of doing euthanasia correctly. There are ways that you see it done and you're like, well, I'm never going to do it like that. Yeah. I'm never going to do it like, you know. And also understand, as a mentee, as a mentor, we don't know why stuff works, but it does. So we go back to it. right? I mean, what is that drug? I don't know. I know if I give one shot, the diarrhea goes away. The client's happy because they're not up at 2 a.m. We'll leave it at that, right? But, you know, as a mentee, they have to understand the mentors aren't going to have all the answers.
That's right. Yeah. And mentors also have to be comfortable saying, I don't have all the answers. But I think that's so important as a mentor to say, I don't have all the answers, or I don't know, because it's a way that we can model for mentees that you can say that. You can even say that to your clients. I don't know.
Right.
And I love the piece about like the listening that you were talking about. You know, I remember being a new grad and I was at a big practice and there was a doctor's office, and I would sit in the doctor's office every evening when all of us would be writing up our records and doing our lab callbacks, and I would just listen to how those doctors were communicating over the phone, and I wrote down the language that they used that I wanted to use for myself, because I really loved hearing them kind of interact with their clients. So listening is key. And then the other thing I heard you saying is, it sounds like you as a mentee, you were like very motivated to move that relationship forward. You were very proactive as opposed to waiting for mentorship to just come to you.
And it has to be on both sides.
Yeah.
And getting back to that large practice concept, I actually had a doctor that I had interviewed that I was excited because I love teaching early career vets, try to soften the landing, let's say, out of vet school, or soften the landing out of that horrendous first or second job they had, just to show them how wonderful this profession is. Because I think the only person I know that loves this profession as much as I do is probably you, right?
Yeah.
And at least for our generation.
Yeah. Yes.
The older, the boomer veterinarians, they love the profession.
Love it.
But the problem with the boomers is once they're gone,
Yeah.
right? There's no, like, they're fishing in Wyoming. They're,
As they should be.
they're living on an island in Alaska.
They've earned it.
Right. But, the thing is, I want to be able to give back, right? Give back. And I don't even know where I was going with this. But, getting back. So with the large practice, just because the girl came in and she's like, well, I'm going to go to this practice because there are 8 doctors. And the last thing I told her was, just because there are 8 doctors there does not mean you're going to have 8 mentors.
No. That's such good advice. Yeah.
Right? If you have whenever I interviewed people and it wasn't like a bait and switch type thing, I would say, this is what I promise you as a mentor. And I know you said to get it in writing on one of your podcasts.
Yeah, a mentorship agreement.
Yeah, but I mean, like, here's my cell phone number. You call it 24/7. If I'm here, I'm here. But don't expect me to always hold your hand. Like, if you're going in there for a surgery for the first time, I have no problem being in the surgical suite with you. I'm not going to gown up. I'll walk you through it. If you do get in trouble, I will jump in. But it's like, you have the skills. You need the confidence. And I don't think a mentor that's like going to maybe hold your hand and walk you through every step is going to allow that to grow and that your professional identity to bloom. But
this is reminding me of this really funny story. I had a mentee, and I just adored her so much. And she was actually the inspiration for Ready Vet Go. And she was a associate of mine that we hired. She was a 2020 grad. And I helped her with a lot of things, including surgery. I had
during COVID.
During COVID, it was a really rough time. Everything was curbside. So she and I became very tight. And I had never spayed a rabbit before. And the local shelter, it was COVID, everyone was just overwhelmed, and the shelter vet couldn't spay the rabbits in the shelter. My mentee was hot off an externship at a shelter, and she was a whiz at spaying rabbits. And so the shelter was giving vouchers to people who would adopt rabbits and take them to their local vet to spay them. And so when my clients came and said, I want to get a bunny, and will you spay it? And I said, I've actually never done that, but I have a mentee who's really good at it. And she said she'd help me. So if you would allow me to do that, I would love the opportunity.
So the relationship flipped.
And so exactly what you were just describing, Dr. Katie was standing across from the surgery table from me, not gowned up like I wanted her to be. And she was like my cheerleader. She goes, you can do it, Dr. Rabwin. And I just wanted her to just get in there and like do it and help me. And instead, she just was basically my cheerleader and talked me through it. And it was really amazing. And I realized, like, that's what I'd been doing for her and so many other mentees over the years. And it was fun to be on the other side.
So basically what you're saying is we've never perfected veterinary medicine, right?
No.
We're still practicing.
Oh, gosh. Always.
And so, by the way, rabbit spays are very easy.
Well, usually, I know that now, but I think
once you cut in the abdomen, the uterus is right there. You got to make sure you ligate that uterine artery. But anyways, but no, I mean, but the thing is also do the see one, do one, teach one.
Yeah.
Right? And that's what you were doing.
Yep.
She saw one, she did one.
Yeah.
She taught you.
Exactly.
So so the young grasshopper.
Right. Yeah.
It did it for you.
Exactly.
Yeah.
I want to talk about your ownership journey. So how did you get into practice ownership? Is that something that was always a goal for you? How did you end up owning your own practice?
The beauty of veterinary medicine is that you can be an entrepreneur, a manager, and a doctor all at the same time. And my dad had his PhD in economics from Oxford, so I was always brought around business. I knew I was going to own my own practice. I know, and then you also have to look at yourself and say, truly, am I someone who can work for someone my whole life? Right? Are you that type of person? Most veterinarians are not. But they're not really big risk takers. I'm a risk taker. So the entrepreneur hat is huge. So I knew the day I graduated, I knew I didn't want an internship. I knew I wanted general practice. I knew I wanted to own practices. I knew I wanted to lead people, and I knew I wanted to teach people. Those are the 5 things I knew coming out, which I don't know truly how many young vets know because they come out scared.
Yeah. Yeah.
Right?
There's a lot of fear.
Fear. Like, it's like, and it's funny because on another hand, like, we all had to defend our proposals for our research in our doctorate program, right?
In your current doctorate program.
My current doctorate program. And everyone is so scared. And I finally just blurted out to everybody with a professor sitting there, which is, they don't know what you're talking about. So anything that comes out of your mouth, they're going to agree with because you have been doing the research.
Right.
So if they realize, I know more than the client really does, at least put on that facade and learn the trick of, oh my goodness, hold on a second. Let me go check something. And then run and look in the textbook like,
Yes,
and
we've all done it. We've all done that.
Yeah. And nowadays it's even easier because you got your phone, right?
Yep.
Because then you can like look at Plum on the phone, look at Vin on the phone, look at, oh gosh, they have so many apps now that we didn't have. We had the Veterinary Nerd Book. You remember that?
Oh, yeah.
My wife still uses that thing.
I've pulled it out. I still have mine.
Do you really?
Yeah.
Wow. But it's like, there's no problem. Just make sure you know where you kept your little thing, that your cheat sheet.
Yep.
And you can always go back and look at it. And there's also nothing wrong with saying, you know what? Wow, this is a very interesting case. Let me go get another opinion because I have a couple other doctors here.
Yes.
We'll come up with a plan and we'll let you know. Clients actually respect that.
I love that. And I love that language. You know, it's sort of like we're all part of a team. Like, we will let you know. Like, we're going to come up with a solution for you.
Right.
You know, it's not just me. I'm here with you as the pet owner. We're all in service of your pet, our patient. And clients do really respect when you can say that. You know, I'd like to get another opinion. I'll sometimes say, like, I just heard my coworker who was at a conference, and I know that she was at a talk where they were talking about this exactly. So I want to make sure that I'm up to date on all of the latest information. And that's a good way to kind of get me out of a room and confer with my my colleagues.
I just read an article in one of our journals on something just like that. Let me go check that really
quick. Yes. And clients really
Meanwhile, it's
appreciate that.
It's Ettinger you're looking at or some textbook. But I mean, the thing is, you just got to learn to play the game.
Yeah.
It is, and I don't want to say our profession's a game, but it is a game, right? You got to learn how to play the game, how to talk to clients. You got to learn how to break bad news. You need to learn how to do a bunch of stuff. But the biggest thing you veterinarians need to learn to do, and it's so hard because we're so busy, is to show true emotion.
I always say that veterinarians and veterinary professionals are deeply empathetic people. We're just not as good at expressing it. And I do think there's a difference between like showing emotion and showing empathy, because I do caution early career vets to be careful about the emotional piece, because it is easy to get caught up in that. But we can be very empathetic and express our empathy and connect with our clients in that way. I like to hear that you say that as well. You know, can you talk more about that?
Well, I mean, as you well know, emotional intelligence is a huge piece of my research, and it's a big piece that's missing in veterinary school. The soft skills, the non-technical skills.
Yes.
Now, I've interviewed a bunch of veterinarians, early career vets, and they're saying, oh yeah, Davis, we have someone come in and we do, we have actors that come in and we have this and that, and it's still not the same. It's like,
it's not.
I'm sitting there thinking, and every time they say it, and I bring it up as well, is like, you remember surgery classes? You remember when they're like, this is and they put up, slides or PowerPoints. Oh, look at this. And you look at the field, there's no blood.
Right. No.
There's no blood on the gloves.
Yeah.
No blood on the gown. It's clean.
Yes.
And then you go in for your first like cat neuter, right? Yeah. You're like, oh my gosh, look at all this blood. Right?
Yeah.
But the thing is, like, actors is still, it's when your butt's on the line.
Yeah.
And, and when I say your butt's on the line, it's your identity, it's your license, it's your persona, it's your Yelp review.
Yeah.
Like, all those things are on. There's no actor that will prepare you for that.
Yeah.
And when it comes to emotional intelligence, you have to learn how to regulate your own emotions. You need to learn how to read the room. You need to learn about how your emotions affect others. And you also have to learn how to steer a conversation.
So you're saying these are things you have to learn. So these are teachable.
They're very
and
teachable.
learnable.
Correct. Just like leadership is teachable.
Yep.
You're not born a leader. I think emotional intelligence is something that you need to read about. You need to learn. There's so many great things online. There's so many great books.
Can you think of any? Or we can
Yeah, I'm brain farting right now.
Okay. Well, we'll
yeah, no, I mean
we'll add them.
Yeah, I'll put links to all of them. But
Okay.
Wong and Law is who I'm using. Wong and Law, I look at emotional intelligence piece. They're the ones who brought it to the modern day because it really brings in all the 4 dimensions of emotional intelligence, and you just got to kind of look at what they're talking about.
Yeah.
Veterinarians are so smart; they basically need to read one empirical article about emotional intelligence, and they'll get exactly where it's coming from.
Yep.
But it's a skill, just like learning to spay a dog, learning to pull blood, learning to put a catheter.
Yeah.
It's a skill that you need to learn and teach yourself, because if you can keep your emotions in check, when you have that irate client, how do you talk them off the ledge? They don't teach that.
When should that be taught? Where should that be taught? How should that be incorporated into either veterinary curriculum or into mentorship programs, or these things that people should be thinking about before they get into veterinary school?
Well, emotional intelligence, I'm bringing it to the attention of everyone who's all the parents in high school. Right? Like when a teenager has an absolute breakdown because their phone is dead, that's a lack of emotional intelligence.
Yeah.
When you have people that are sitting there deciding that, what we call, they're having meltdowns after what we call first world problems.
Right. Yeah.
That's a lack of emotional intelligence.
So early.
I think, obviously if you have anyone, if the earlier the better.
Yeah.
My youngest daughter is seeing a sports psychologist, because as a parent, you always want better for your kids. So I just want her to just sit there and learn. But I told the sports psychologist, I'm like, my daughter lacks emotional intelligence. Because her emotions spike and they die and they spike, and that's kind of, if you keep that in mind, think of that in a veterinary practice, right? Like what do we always tell people? Leave the drama at the door. Leave your home life at the door, which is impossible to do because we're humans.
That's right.
But if you're able to check your emotions when you walk in the door, you'll be able to handle that. Like one things we also talk about, at least in my dissertation, is psychological safety, toxicity of a workplace. And you have to be able to take the drama of what's going on amongst the staff and not bring that in the exam room.
Yeah. It's a hard thing to do.
It is a very hard thing to do.
Yeah.
And that's so, should it be introduced in veterinary school? 1,000%.
Yeah.
It should be almost a required course in undergrad? Absolutely. But people we're more worried about IQ, not EQ.
Yeah. I do want to know the difference between IQ and EQ, and have you talk about that. I just, I'm just so fascinated by this being after everything that you've been through with your career, that emotional intelligence is currently the thing that you are so passionate about. This is your dissertation project for your doctorate. You're writing the chapter on emotional intelligence for my veterinary mentorship book, which I cannot wait to have everybody read, because we've got to get this information out into the hands.
It shouldn't be chapter 8, by the way. It should be chapter 1. But that's okay.
Everyone thinks their chapter in my book is the most important chapter on veterinary mentorship. We'll see. Maybe we can move it around a little bit.
I could give you money under the table.
I know. So how did this come to be the thing that you are so deeply passionate about?
Well, when I was bought out, there was an article that came out that was talking about the economic effect of burnout in veterinary medicine. Great article. and basically bottom line is it's costing the industry $2 to $4 billion a year.
Whoa. Burnout among veterinary professionals costs the industry $2 to $4 billion a year.
That's just a little bit.
Yeah.
Not much, right?
Yeah, just a little bit.
Just a little bit. So, but I was like, what the heck? And then
Yeah.
obviously now that I, was just a veterinarian, I didn't have the entrepreneurial hat or the managerial hat anymore. Number one, I felt the effects of the burnout because see, I think looking back, I was burning out,
Yeah.
but I was able to dilute that. Like I could, if I had a difficult room, I could immediately go back and do P&Ls, or I could talk to my manager about staff problems or,
Yeah.
promotions, or like I could hide it.
Yeah.
I didn't have that anymore. So I started reading more and more articles. And then all of a sudden I started looking into the burnout piece.
Yeah.
And I think the burnout articles, for what they're worth, are excellent to bring it to the forefront. But, when you and I graduated, there's probably a couple articles on burnout.
Yeah.
And then after, the Great Recession, or the Great Recession in 08, then compassion fatigue became the hotbed.
Yes.
And then all of a sudden during COVID, it was the Great Resignation. And you look at veterinary medicine, the most equal profession is nursing. Because if you're in a hospital, a human hospital, you see your doctor for what, 5 minutes? You see your nurses 24/7.
Right.
And they're actively involved with you as the patient. They're actively involved with your family. And then especially during COVID, they're the ones holding the hands as people were passing away because families weren't allowed in, right? And you think about that, that's what we do, right? We are, we're the psychologist for the family.
Yeah.
We are the social worker for the family. We are the patient advocate for the animal.
Yeah.
And, also since COVID, the cost of care piece has become really big.
Yep.
And it's very hard as a profession to know that you can treat and cure that animal, but because of cost now, they can't do it.